In 2018, the United States spent $3.6 trillion on healthcare. This song explores the history of health insurance in the United States. What's the cause of sickness when you have misfortune in a vulnerable position? Need help but can't afford it. Reform's been amorphous, thwarted and supported. This is the story of health insurance. What's the cause of sickness when you have misfortune in a vulnerable position? Need help but can't afford it. Reform's been amorphous, thwarted and supported. This is the story of health insurance. Our story begins with sickness in the Great Depression. At 1,200 school teachers in the state of Texas, Baylor offered prepaid hospital care. Gave them 21 days for $6 a year. Then this model spread to Sacramento when 3 hospitals made a plan that's preferential. Patients therefore could pick and choose any community hospital when illness brewed. Truthfully, less competition, so they mutually grew. Consolidated statewide into a cross that was blue. Other entities were shielded by indemnity, yielded more choice for hospitals that met the needs. But the way Blue Shield protected was the major distinction. They paid the patient, who in turn paid the physician. The ross-loos clinic was ahead of the evidence, cause its prepaid health plans were preventative medicine. This emphasis was important to the founders, and 400 enrolled from LA's Water and Power. For $18 a year, besides the basics, they got maternity care and immunizations. What's the cause of sickness when you have misfortune in a vulnerable position? Need help but can't afford it. Reform's been amorphous, thwarted and supported. This is the story of health insurance. What's the cause of sickness when you have misfortune in a vulnerable position? Need help but can't afford it. Reform's been amorphous, thwarted and supported. This is the story of health insurance. Bankruptcy looming, need a regime change, so Dr. Garfield built on the model of prepaid. 5,000 aqueduct workers line this legend, short for a dime a day in the Mojave Desert. Him and Henry Kaiser kicked off when the past crisscrossed, bringing prepaid to Cooley Dam and the shipyards. Then the war came. Wage and price controls led to more pain, cause people needed more pay. Since health insurance wasn't considered a wage, firms attracted employees by giving it away. Insurance continued growing sharply with Taft-Hartley. Collective bargaining with both parties found it less costly. And that's the big one, cause employer-sponsored health insurance was exempt from taxable income. Now this tax subsidy for employee insurance would in fact come to be of enormous importance. What's the cause of sickness when you have misfortune in a vulnerable position? Need help but can't afford it. Reform's been amorphous, thwarted and supported. This is the story of health insurance. What's the cause of sickness when you have misfortune in a vulnerable position? Need help but can't afford it. Reform's been amorphous, thwarted and supported. This is the story of health insurance. In the 40s, insurance boomed in the nation with sales supporting the use of community rating. It was simple with subscribers and one large risk pool. Everyone paid the same until the part was chiseled. Commercial insurers cherry-picked the healthy ones, and since then experience was used to sell premiums. But Blue Cross wasn't keeping up. Without a business model change, they'd be bankrupt. And that was the death of community rating, leaving elderly uninsured, so Medicare came in. It's a earned right, sweat equity payment, modeled after Blue Cross's way of arrangement. So Part A paid hospitals and B paid doctors. But what about the uninsured poor couldn't save dollars? That's a problem, partially solved by Medicaid if you're pregnant, disabled, or accepted age. What's the cause of sickness when you have misfortune in a vulnerable position? Need help but can't afford it. Reform's been amorphous, thwarted and supported. This is the story of health insurance. What's the cause of sickness when you have misfortune in a vulnerable position? Need help but can't afford it.